Unplanned pregnancies can be a source of anxiety and stress for many women. In such situations, emergency contraceptive pills, ECPs, can provide a safe and effective solution. Two popular options in the market are Ulipristal and Levonorgestrel. While both ECPs offer reliable protection, they differ in terms of their active ingredients and mechanisms of action. Ulipristal, marketed under the brand name Ella, is a selective progesterone receptor modulator. It works by inhibiting or delaying ovulation, thereby preventing fertilization. On the other hand, Levonorgestrel, commonly known as Plan B, is a progestin hormone that primarily works by preventing the release of an egg from the ovary and altering the lining of the uterus to inhibit implantation. It's important to note that emergency contraception should be taken as soon as possible after unprotected intercourse or contraceptive failure. Timing is crucial, as the effectiveness of these pills decreases with each passing hour. In this video, we will delve into the differences between Ulipristal and Levonorgestrel emergency contraceptive pills. By understanding their unique properties and modes of action, women can make informed decisions about which option may be best suited for their needs. Understanding Ulipristal and Levonorgestrel. Ulipristal and Levonorgestrel are both emergency contraceptive pills that are commonly used to prevent unintended pregnancies. However, they differ in their active ingredients and mechanisms of action. Ulipristal, also known by its brand name Ella, is a selective progesterone receptor modulator, SPRM. It works by inhibiting or delaying ovulation, which is the release of an egg from the ovary. By preventing ovulation, Ulipristal reduces the chances of fertilization occurring. Levonorgestrel, often referred to as Plan B, is a progestin hormone. It primarily works by preventing the release of an egg from the ovary. Additionally, Levonorgestrel alters the lining of the uterus, making it less receptive to implantation. This dual mechanism of action helps to further decrease the likelihood of pregnancy. Mechanism of action of Ulipristal and Levonorgestrel. Ulipristal and Levonorgestrel have different mechanisms of action, which contribute to their effectiveness in preventing unintended pregnancies. Ulipristal works by selectively binding to progesterone receptors in the body. This binding inhibits or delays the release of luteinizing hormone, LH, which is necessary for the release of an egg from the ovary. Without LH, ovulation does not occur, preventing fertilization. Levonorgestrel, on the other hand, primarily works by preventing the release of an egg from the ovary. It does this by increasing the levels of a hormone called progesterone in the body. Progesterone inhibits the production of follicle-stimulating hormone, FSH, and LH, which are necessary for the release of an egg. By preventing ovulation, Levonorgestrel reduces the chances of fertilization. In addition to preventing ovulation, Levonorgestrel also alters the lining of the uterus. This makes it more difficult for a fertilized egg to implant and establish pregnancy. While this secondary mechanism is not present in Ulipristal, it contributes to the overall efficacy of Levonorgestrel as an emergency contraceptive. Effectiveness of Ulipristal and Levonorgestrel. When it comes to emergency contraception, effectiveness is a crucial factor to consider. Both Ulipristal and Levonorgestrel have been shown to be highly effective in preventing unintended pregnancies, especially when taken as soon as possible after unprotected intercourse or contraceptive failure. Ulipristal has been found to be up to 98% effective when taken within 72 hours of unprotected sex. Its effectiveness decreases slightly if taken between 72 and 120 hours, but it still provides significant protection against pregnancy. However, it is important to note that Ulipristal is not as effective as a regular contraceptive method and should only be used in emergency situations. Levonorgestrel is also highly effective when taken within 72 hours of unprotected intercourse. It has been found to be up to 95% effective within this time frame. Similar to Ulipristal, its effectiveness decreases if taken between 72 and 120 hours, but it still provides substantial protection against pregnancy. It's worth mentioning that both Ulipristal and Levonorgestrel may be less effective in women with a higher body mass index, BMI. Studies have shown that the efficacy of these emergency contraceptive pills may decrease in women with a BMI over 30. In such cases, alternative contraceptive methods or consultation with a healthcare professional may be necessary. Side effects and considerations of Ulipristal. Like any medication, Ulipristal may cause side effects in some individuals. The most common side effects reported with Ulipristal include headache, nausea, abdominal pain, and menstrual changes. These side effects are generally mild and subside on their own without requiring medical intervention. It's important to note that Ulipristal is not intended for use during an established pregnancy. If a woman becomes pregnant after taking Ulipristal, it is recommended to consult a healthcare professional for further guidance. Ulipristal may also interact with certain medications, such as rifampicin and St. John's wort, reducing its effectiveness. It is important to disclose all current medications, including over-the-counter drugs and herbal supplements, to a healthcare professional before taking Ulipristal. Side effects and considerations of Levonorgestrel. Levonorgestrel, like Ulipristal, may cause side effects in some individuals. The most common side effects reported with Levonorgestrel include nausea, vomiting, fatigue, headache, and breast tenderness. These side effects are generally mild and temporary. It's worth noting that Levonorgestrel may cause menstrual irregularities, such as changes in the timing or flow of periods. These irregularities usually resolve on their own within a few cycles. However, if the changes persist or are concerning, it is advisable to seek medical advice. Similar to Ulipristal, Levonorgestrel is not intended for use during an established pregnancy. If a woman becomes pregnant after taking Levonorgestrel, it is recommended to consult a healthcare professional for further guidance. Availability and accessibility of Ulipristal and Levonorgestrel. Both Ulipristal and Levonorgestrel are available as over-the-counter emergency contraceptive pills in many countries. This means that they can be purchased without a prescription from a healthcare professional. However, availability and accessibility may vary depending on the country and local regulations. It's important for women to be aware of the regulations and availability of emergency contraceptive pills in their region. In some cases, Ulipristal may require a prescription, while Levonorgestrel may be available over the counter. It is advisable to consult a healthcare professional or a pharmacist for guidance on the availability and accessibility of these emergency contraceptive options. Choosing the right emergency contraceptive pill for you. When it comes to choosing an emergency contraceptive pill, it's important to consider various factors that may influence effectiveness, side effects, and accessibility. Some key considerations include time frame. Both Ulipristal and Levonorgestrel are most effective when taken as soon as possible after unprotected intercourse or contraceptive failure. It is advisable to take these pills within 72 hours, although Ulipristal may be effective up to 120 hours. Delaying the intake may reduce their efficacy. BMI. Women with a higher body mass index, BMI, may experience reduced efficacy of emergency contraceptive pills. If you have a BMI over 30, it is recommended to consult a healthcare professional for guidance on alternative options. Side effects. Consider the potential side effects associated with each pill. While both Ulipristal and Levonorgestrel may cause mild side effects, individual experiences may vary. It is important to be aware of the possible side effects and consult a healthcare professional if any concerns arise. Accessibility. Check the availability and accessibility of Ulipristal and Levonorgestrel in your region. Regulations may vary, and it is advisable to consult a healthcare professional or a pharmacist for guidance on obtaining these emergency contraceptive pills. Personal preference. Ultimately, the choice between Ulipristal and Levonorgestrel may come down to personal preference. Some women may prefer one over the other based on factors such as mechanism of action, side effect profile, or previous experiences. Consultation with a healthcare professional. While emergency contraceptive pills like Ulipristal and Levonorgestrel are available over the counter, it is always recommended to consult a healthcare professional for personalized advice and guidance. A healthcare professional can provide information specific to your situation, answer any questions you may have, and discuss alternative contraceptive options. Additionally, a healthcare professional can help address any concerns or provide further information about the specific mechanisms of action, side effects, and efficacy of Ulipristal and Levonorgestrel. They can also offer guidance on the appropriate use of emergency contraception and provide recommendations for ongoing contraceptive methods. Conclusion and final thoughts. Ulipristal and Levonorgestrel are two popular emergency contraceptive pills that provide effective protection against unintended pregnancies. While both options have their unique properties and mechanisms of action, they share a common goal of preventing pregnancy when taken within the appropriate time frame. When considering Ulipristal or Levonorgestrel as emergency contraception, it is important to be aware of their individual mechanisms of action, effectiveness, potential side effects, and accessibility. Consulting a healthcare professional is highly recommended to ensure personalized advice and guidance. Ultimately, the choice between Ulipristal and Levonorgestrel may depend on personal preferences, individual circumstances, and the availability of these emergency contraceptive pills in your region. By understanding the differences between these options, women can make informed decisions about which emergency contraceptive pill may be best suited for their needs.